Good afternoon and welcome to this, our fourth of our Network Fest webinars. Great to have you on the line today. My name's Rich.
I'm Danny Ryan.
I'm Anna Howells.
And I should say, if you've joined every single one of the webinars this week, award yourself a virtual gold star, or even drop us a tweet and we'll send you a gold star in the post. Really grateful for your time now, and if you have joined others, thank you for that as well. And the whole point of Network Fest is about celebrating all that's great about learning networks all across the world. It's sort of our focus here at Kaleidoscope, but particularly thinking about some really sort of practical, knotty issues which networks deal with, and think about how we can overcome them with the help of a fantastic global panel who we'll introduce in a bit. But first off, we really want this to be a sort of interactive debate, discussion. Anna, how can people get involved?
Yep, so there's two ways you can join the conversation, either via Twitter using hashtag NetworkFest, and our Twitter handle is @KScopeHealth, or via the chat box facility that should be on your screens.
Excellent, good. And apologies, if you are dialing into your fourth webinar, you might have heard that before, but it never helps to repeat it. Never hurts to repeat it. Danny, what are we talking about today?
So far this week we've covered how to manage a network, how the network communicates, and how to deal with disengaged members of your network. Today we're going to be talking about how do you measure the success of your network. You've got it up and running, everyone's on board, you've got your communication infrastructure going, but how do you measure that success? How do you tell if you're meeting the purpose of your network? And purpose is a lot this week. So we've got a fantastic panel today. We've got George Dalal from Cincinnati Children's Hospital and Sam Jones, former Chief Exec and Head of the New Care Models team at NHS England. So, I've got anything.
Well, I think just to say, it's been funny that I think in each of the webinars we've done this week, we've come back to purpose, and purpose being really critical to the success of any network. But sort of the flip side of having a clear purpose is actually knowing whether you're meeting it or not. So it's almost like we planned this to lead neatly on. So I think we're going to have a great session today.
Brilliant.
So George, I think we're going to start with you, and then we'll go to Sam, and then we'll open up for questions and debate.
Sounds good.
Great, good. George, I'll pop your slides up, but if you want to introduce, we'll get going.
Yeah, fantastic. Thank you, team. It's really a pleasure to be here. And I think measurement can be a little bit of a geeky topic, but it's one that I'm really passionate about. And I think hopefully, we'll learn today how crucial and important it is. So by means of introduction, my name's George Dalal. I grew up in London, but have spent the last, I think, 8 years or so living in Ohio, working in Cincinnati Children's, where we develop and manage and run and support learning networks. We think of learning networks as communities of patients and families and clinicians and scientists who use data for clinical care, improvement, discovery, and innovation. So we have, over the last 8 or 9 years ago, developed 5 mature networks, and we have about 15 more kind of nascent networks. We have 270 member clinics and hospitals across 43 states and 4 countries, including a couple of member care centres in the UK, which is very exciting and a more recent advancement. So if you flip to the slide, we've already touched on this, which is fantastic, and this has been a common theme, but it is absolutely crucial. Before we can even think about measuring the success of the network, we need to be aligned and clear around what we want the network to achieve. And I put here before measurement comes purpose, and maybe I should have really said shared purpose. And I think one of the key factors for a successful network is having shared purpose that the leadership and the members are all bought into. At Cincinnati Children's, our network's primary purpose is to improve the outcomes of the populations they serve. And for all of our networks, we mandate that member clinics and member hospitals submit data on the outcomes of their patients. And when you do that, you can produce graphs like the ones on the next slide, which depict the improvement in outcomes achieved by our 4 more mature networks. And so the graph on the top left depicts the improvement in remission rates that our IBD network has achieved. The bottom left shows the reduction in significant safety events that our safety network has enabled. Top right shows the reduction in interstage mortality of our cardiology network, and bottom right depicts the reduction in preterm births that our perinatal network has produced locally here in Ohio. These results have been achieved without new therapies, just through the application of good QI and the sharing of best practices. And one of our mottos is to share seamlessly and steal shamelessly. And it's through that we've enabled these communities to flourish and been able to deliver these results, which have all been kind of published in journals, and we can send around the references later on. So if you flip to the next slide, in addition to measuring the clinical outcomes of the populations our networks serve, we also measure several network processes that help us gauge the health of the network and our performance as network facilitators. This is a snapshot from a dashboard of the cystic fibrosis network that I currently support, and there's a few different kind of categories of measures that I thought I'd just briefly touch on today. On the top left, our team participation measures help us understand how completely teams are participating in network activities. So it's a little bit hard to read, but the example on the far top left is the percentage of our member care centers who join our webinars each month. And the other graph in blue, just slightly to the right, shows the percentage of member care centers who are completing the expectation we've set of executing at least one improvement test cycle each month. On the right-hand side, in addition to team participation, we also track team contribution. And that graph on the top right shows the percentage of teams who are contributing at least one resource to our knowledge sharing platform each month. So one of our principles for our networks is all teach, all learn. And so we want to make sure that teams are not only participating, but also contributing to the network as well. On the bottom left, we think of our teams and our member care centers as our customers. And each month we measure the satisfaction that they have in the network. And one of the things that maybe is a little bit different about our networks versus some of the other models is that many of our care centers pay to participate in the network, and in that sense they truly are customers. And then on the right-hand side, on the bottom right, is one of our data quality measures, and this is kind of how accurately and how timely our care centers are entering in that clinical data, which enables us to produce reliable graphs like the ones I showed on the previous slide. I'll mention as well that this dashboard and these measures and many others as well are something that our leadership team reviews monthly, and we're able to kind of drill down into these and see, well, which teams are struggling, which teams are our top performers, and then kind of target some outreach so that we're learning from those lead users and helping those who maybe aren't able to participate or contribute as much. So flip to the next slide, and this is kind of interesting and something we've been experimenting with a little bit more recently. In addition to measuring those process measures for the health of the network, and in addition to the outcome measures that we talked about up front, we've also been starting to think about how we can measure the sense of community. I think this starts to get at a little bit of what Chris McCarthy calls the trust that's been so crucial to a network. And these measures that you can see up on the screen were adapted from the Sense of Community Index that's been developed by a great think tank out of DC called Community Science. I think what we're trying to get at here is that our networks really rely on this culture of generosity and contribution. And these measures enable us to understand the extent to which participants feel that they have ownership and agency of the network. It's really important that our networks aren't seen as being Georgia's networks or Cincinnati Children's networks or Kaleidoscope's networks, but that they're led and developed by the members of the community themselves. And so these measures that we just track on a Likert scale start to try to get that agency and that ownership from the members. So I think I'll leave it there. Looking forward to discussing and answering questions and hearing from Sam as well. But hopefully that's given you a sense of kind of how we measure our networks at Cincinnati Children's.
George, thank you very much indeed. And we should say we've got a bit blasé about people joining us at early hours after Chris McCarthy's 4 a.m. start yesterday. But George, it's 7 a.m. with you, and you're already in the office, I think, aren't you, by the looks of it? So dedication, thank you very much indeed for joining. And George, I think it's okay for us to share these slides as well with participants.
Yes, absolutely. Yeah, you're welcome to share these slides.
Lovely. So I'm gonna pop them off now, but we will send them around so people can have them later on. Great, George. Thank you very much. Sam, over to you. Thanks so much for joining.
Hi, thanks, Richard. I was hanging on your every word there, George. So whilst you were talking, thinking how far we've got to go in terms of being able to measure the impact and the power of networks that we use and that we get very used to. So I have had the privilege of leading a national program which was fundamentally built on a network of people working together to prototype new care models across the country. I was thinking about on the way into London today how many networks I'm part of informally. So I rely on networks to keep me going, my family going, that network of WhatsApp. What did we do before WhatsApp in terms of has anybody seen George's blazer, or what's happening with what we're supposed to be doing for school, including more probably formal professional networks around ensuring that we share knowledge. And I can't even begin to try and compete with the level of analysis and evaluation that we have. But what I can, we've just seen from George, but what was struck me about what you were saying, George, was the interventions and the impact that you have been able to demonstrate were absolutely as a result of the power of the network rather than any other interventions. Is that correct?
Yeah, that is, yeah. I can talk a little bit more about that later on as well.
I think that would be, sorry to obviously take over the role of the questioner here, but that would be really useful because I think we're very shy of quantifying why a network is so important and why the power of the joy, the power of the relationships and the impact. And I think that the more that we can learn and evaluate quantitatively as well as qualitatively, certainly I think we have some way to go with that.
Sam, thank you very much. I should say, look, we're talking about leadership from the community as important in networks, not in these webinars. Thank you very much. These webinars are hierarchical invited on as a panelist to be a panelist, not to question other people, please.
Sorry.
Sam, really interesting, and interesting sort of talking about WhatsApp and technology and sort of linking a bit to Chris's discussion yesterday about technical tools to keep communication flowing. We're going to go, I think, straight to, we've got questions coming through, Anna.
We do indeed. Thanks, Louise, and please keep sending your questions through.
How can people do so, just to remind?
Either via Twitter using #NetworkFest or using the chat box facility.
Great.
So our first question, thank you, Austin, for this. It's for George. So the outcomes that you mentioned, we're just wondering how they were decided. So what were the organisational needs that and made you pick these over other possible measures available?
Great question. George.
Great, yeah, so I heard the first part, how were the outcomes decided? And I think before we kind of formally launch a network and start recruiting member care centres, we run a design process with prominent members of the community, and we try and make this pretty representative of some of the stakeholders involved. So most of our networks are pediatric based, and so we'll bring together parents, sometimes patients, but often they're too young, depending on the condition, and then clinicians and researchers. And we'll run a design process which is trying to get at kind of what are the outcomes that matter to the community. And when we'll emerge from that, hopefully some consensus from some of the thought leaders in the community, and then it becomes their job to sell those measures and those outcomes that we're going after to their peers and colleagues as we start to recruit and join the member care centres.
Great. So it's very much to your point, George, about saying this isn't George Delisle's network, it's the community's network that's embodied right from the start, from that design phase.
Right, exactly.
Excellent. I think we've got questions piling up. So and 14 minutes to get to 76 questions. Excellent. That's great.
I'll be quick. So we have a question from Suzette. So the importance of networks for her are the connections, relationships, and conversations that can take place. So how do you measure things like those factors?
Should we start with George, but then Sam, it'd be really interesting to get your take on how you sort of try to even get your head around that with regards to the Vanguard program. That's okay. But George first. That's okay.
So how do you measure just repeat the last sentence, how do you measure the connections and conversations, was it?
Yeah, connections, relationships, and conversations.
It's really hard to do, and to do well and to do with rigor. One of the things that we're able to do on some of our networks is use a knowledge sharing platform. And so when you do something like that, and we have a kind of homegrown one that we call the Exchange here, it's got some kind of discussion forum capability, and you're able to measure the number of folks who are contributing to that and discussing and posing questions and responding. I think more traditionally and more easily, networks will use listservs, and I think in that sense it's pretty easy to measure the amount of activity that's taking place on those. But I think those are some of the ways that you can start to get at that. I think it is tricky because measuring the relationships and the density of the network, one can do with sophisticated social network analysis, but that requires yet more data collection. So I think I'd encourage folks just to think in terms of number of responses to the listserv. One nice measure that we like to use, especially amongst our patient communities, is if I pose a question to my community, am I confident that I'll get a reliable response within 24 hours? And so if you think of patient forums and community websites, that's a kind of nice measure to think about, and it's easily measurable.
George, really nice point. Thank you very much. And Sam, over to you. Sort of, what are your thoughts on this? Sort of having led the Vanguard program, which was so much about trying to foster those connections.
Well, everything George has said, which is basically all I'm going to say all through this cast. We had an online collaboration platform. Wanted to make sure that we understood and responded to different people's needs around how they communicate and how they build those relationships. So some people absolutely like to have chat rooms, and that's available. It still continues to be available for anybody interested in new care models, not just the Vanguard. We created communities of practice, so felt it was really important that these were externally facilitated, separate to anything or any being from the national body, but it was really for people to have a safe space to be able to talk about what they were doing. And I suppose the only bit that I would add, and then all the usual things, as I say, but the other bit I'd add to what George has said was we spent a lot of time asking the people who were using those networks what impact it was having, and was it making a difference, and was it useful? So there were some very traditional ways, call me old-fashioned, but actually talking face-to-face and understanding what would have been more useful for them, or what would they find useful, because it was very much led by them. So I would add that to what George said, and those networks continue because the success of the network is not because it's an infrastructure or an architecture in isolation.
And Sam, thanks very much. I would pick up on the irony of the proponent of face-to-face not being able to see that face, but Sam, that would be a bit mean. So just out of interest, what was the online the system you used for communication within Vanguard?
So Kahoots, it's an online collaboration platform, and we'll make sure that the link is shared. I'll just get the details from, or you can get these also the NCM team. It was deliberately. It's also linked, interestingly, with NHS Improvement have their also have a collaboration platform. So the theory being that, if you go in and say, is anybody doing anything on GP extensivists, for example, that you can find anywhere in the country, and then be able to connect with them.
Great stuff. Yeah, and do share the link, Sam. Thank you very much. Anna?
Yes, we have a question from Karen, who asks, what have you learned about measurement in networks? For both of you.
Nice question, Karen. Thank you very much. George, shall we start with you? So you're saying that Cincinnati have been running networks for many years now. Is sort of your current approach to measurement, did you get it right first time, or how much did it evolve? What have you learned over time? And then Sam.
I mean, there's lots to say here, and I think the first thing I say is that we're still learning, and we certainly don't have this right. And I think one of the things that we really want to work on is better integrating patient-reported outcomes into our measurement system and measurement framework. And I think the technology is improving, but I think integrating some of these different technologies into one kind of coherent registry with a common measurement output is something that everyone's still working on, and no one's really cracked yet. I think one of the things that I've certainly learned and has surprised me is that different, I mean, it's obvious in hindsight, but surprised me at the time, is that different stakeholders have very different views around what matters. I was doing some work with the diabetes community a couple of years ago, and when we asked the clinicians to rank the most important measures, it was the more traditional clinical outcomes, hemoglobin A1C, and the standard stuff you'd expect. When we asked the parent and patient community, it was almost a direct opposite, and they really weren't concerned about that, and they really wanted us to focus on the burden of treatment and to be measuring that. And so, by involving all the stakeholders up front and running a decent design process, you can start to get a more balanced scorecard of measures that will enable you to kind of track and hopefully improve what matters to the community.
George, really nice quote. Thank you very much. And Sam, other than everything you've just learned from George over the last 24 minutes, what have you learned in terms of how to measure success in networks?
So I was reflecting that the irony of me talking about evaluation and measures for those people that know me well won't be missed. So with respect to the experts who actually led it in the national programme, Charles Tallock and Suki, just to name check them, who were absolutely the evaluation and measurement experts. And I learned, what did I learn? I learned as a general manager that it was incredibly complex, and that the right thing to do was to have the people who actually understood and had expertise in that area. And I don't say that facetiously. We did a very similar thing in terms of that George described. So each of the vanguards had to describe and were part of the co-creation of the measures of success. There were some very clear national measures. They remain those very clear national measures. But the vanguards also determined their own locally in terms of what was important to them. And that we felt quite strongly about that because they were the key stakeholders who were involved in terms of the design of that. I can say I was party to many a robust debate about how many measures are important and what are the most important ones. And I think the other thing that I learned around it, in a complex system in terms of what we're describing, they need to meet many different stakeholders' requirements. And I smiled wryly when George said that, and I think it's recognising that, not pretending it doesn't exist, and making sure you meet those stakeholders' needs.
Sam, very nice. Thank you very much. We are time is drawing in, but Anna, what questions we got left to chuck at our willing panel?
Yep, sure. So we have a question over Twitter. So George, you were talking about kind of measuring the relationships and perhaps some of the softer side of networks, but in terms of proving how networks actually make a difference to productivity, effectiveness, and reducing waste and costs, is there a different approach for those sort of measurements?
Lovely. Should we take one more question, or should we stick with that? Just in time.
I can say it, and we can see if we have time.
Let's throw it in and see how we get on.
Sure. I think Sam actually sort of answered this in her previous answer. But so in national programmes, when you have multiple demographics and specialisms, how can measures be accurately used? Okay, right. And I think Sam, you did make some really nice points there, and some nice euphemisms about robust discussions, which we're now all picturing. But that's a great question in terms of actually showing the value of networks in terms of productivity, efficiency. Sam, should we start with you first and then go to George? With little time left, we're going to be snappy. But the role of networks in showing their value in terms of the financial side. Sam, then.
They're unquestionable. It cannot just be around relationships and behaviours. The investment of time, the investment of people actually doing things means that irrespective of any financial challenges, we have to be able to evidence and justify the reasons that we're doing it. Whether it's, there's no question about it. And the finance elements and the value more than actually finance is so important. And so no question about it.
Great, Sam, thank you. And George.
So yeah, it's hard to do. I think our safety network is probably the network that's done the most work in this. Through their calculations, by reducing the number of serious safety events, they estimate that over 6,000 children have been saved, spared kind of serious harm from those events. And when you run the maths, one estimate is that's over $100 million kind of saved in extra costs. It is hard to do. You need to make some assumptions. We do have a paper that kind of lays out some of that stuff, but it is tricky. I do think that we're often kind of trying to sell the value of these networks to the member care centres, and so we try and offer maintenance of education, certification credits, and other kind of sweeteners to help recruit some of our clinician members.
George, thank you very much. A mere $100 million saved. I thought you could have tried a bit harder, George, but I think now we've got 2 minutes left. So what I'm going to ask is we're going to come both to George and Sam in just a second. And what we'd love is just sort of one final reflection or one top tip to leave people with, but just to buy you time as you frantically think what you're going to say. And Sam, you're going to go first, so you can't just say what George said. Anna, what's happening next?
So this webinar we have recorded and will be available online for you to view. Then tomorrow is our final webinar, which is all about whether networks have a natural life cycle, and we have Professor Becky will be joining us for that one.
Excellent. And if you don't have time to watch the whole half-hour webinar, is there some easy, bite-sized way of catching up with the webinars which have gone before?
There will be a 90-second summary made by us immediately after this webinar, and that will go out in the next 20 minutes or so.
Gosh, that sounds really. I hope everyone watches that. Excellent. So if we can just go to Sam and then George, one final reflection before we close.
Similar to where I think we started from your webinar yesterday, focus on the North Star, the common purpose, and the mission of the network, and consistently go back to that to ensure that it's meeting the purpose that you set out to achieve.
Really nice point, Sam. Thank you very much. And George, you can just say what Sam said.
What Sam said, and maybe in addition, definitely what Sam said, and then maybe just to mix things up, involve multiple stakeholders. But I think the final thing I'll say is, get going, start before you're ready. If you wait for the perfect set of measures, you'll never get anywhere. But start measuring things, use a quality improvement approach, and then kind of adapt and change them as necessary as you go along and as you increase your learning and confidence.
George, Sam, thank you very much indeed for giving up your time to be on today. And thank you everyone who's joined. Hope you enjoyed it. I hope to see you at tomorrow's webinar. For all other things about learning networks, do have a look at the Kaleidoscope website, kaleidoscope.healthcare. Are we done?
I think so.
That's it, we're done. Great. Thanks very much all. Hope to see you tomorrow. Thanks again.
Thank you, everyone.
Bye.